Robert, thank you. Well, 4 months into this pandemic, and I spoke with a pediatrician who says it's really taking a toll on a lot of children's routines. And so tonight, he's sharing the advice that he's giving his patients.
My biggest concern right now, and I would say I'm sure I'm not the only one that shares this concern, is how this has really affected just the dynamics of the household.
Dr. Raul Sanchez is with the Carithers Pediatric Group in Jacksonville.
We've been in summer mode essentially in some instances since March, and I'm seeing a lot of the structure of the house imploding. I'm seeing, or devolving rather. So I'm seeing sleep times get later and later with kids, even young children. More video gaming, less activity, less structured eating patterns, and so if there's anything that I urge people is to try to get their kids back on a schedule.
That includes having a routine bedtime as you normally would on a school night. Dr. Sanchez says letting go of healthy habits can really create problems.
A lot of the studies show that later and later bedtimes are more associated with psychiatric illness. We see more depression and anxiety with kids that have poor sleep habits. It also just breaks you off of the normal circadian rhythm that is natural to our bodies, which simplistically speaking, our bodies should be asleep when it's dark and awake when it's light.
During the pandemic, he says it's okay for children to spend a little more time on their devices communicating with their friends. But he says pay attention to their screen time.
I usually tell people between 1 to 2 hours a day during this COVID time. But we're getting kids that are doing 4 times, 5 times that every day. And that really gets to be too much. So we just need to watch and control those situations.
Advice I really need to take to heart with my own kids. Now, as far as kids getting COVID, he says most of the cases that his pediatrician's office is seeing, they're not too severe cases. But he wants to remind parents that kids can get COVID, and like adults, they can sometimes be asymptomatic and unknowingly spread it, possibly to the vulnerable population. So that is why he is following the CDC's advice and recommending that children age 2 and up wear a mask in public, also practice social distancing, and of course, wash their hands frequently.